Hello, this is Dr. Anthereca Lane with Conversations with Dr. Lane. Today we have a very exciting guest, Dr. Frederick B. Harris. Dr. Frederick B. Harris is a neurosurgeon. We had the opportunity to talk about a variety of subjects, including success. We even talked a little bit about racism and what happened when he got stopped by the police. We also talked about healthcare. It's so exciting to have Dr. Frederick B. Harris today. Let's get started. Here we go. Hello, this is Dr. Anthereca Lane with Conversations with Dr. Lane. Today we have Dr. Frederick B. Harris. Dr. Harris is a board-certified neurosurgeon with 18 years of experience in treating patients with both spine and brain pathologies. Dr. Harris previously had a career as an engineer at NASA and the Department of Defense and changed careers to pursue his dream of becoming a neurosurgeon. His special areas of interest include complex cervical, thoracic, and lumbar surgery, adult spinal deformity scoliosis treatment, revision surgery of the cervical, thoracic, and lumbar spine, minimally invasive spinal surgery for herniated disc and lumbar fusions, spinal tumors, both inside and outside the spinal cord and spinal canal, brain tumors, adult Chiari malformations, traumatic brain injury, and sports-related brain injury. Dr. Harris believes in carefully listening to and understanding the concerns, symptoms, and fears of each patient while clearly explaining their neurological condition and plan of treatment to their satisfaction. He would like each patient and their family members to leave his office with the comfort and understanding of their next phase of care with all questions answered. Dr. Harris is married. He has 3 children, and it is such a pleasure to have him today. Thanks for coming, Dr. Harris.
Thanks for having me. Thanks for having me. I'm happy to be here.
Dr. Harris, you have accomplished what few have been able to achieve. You are a part of an elite group of surgeons and even worked as a NASA engineer. This sparks my curiosity about your family and your upbringing. Tell me about your parents. What was the philosophy in your household about education?
Well, my parents are both from Mississippi. They both went to Jackson State University. My father went on to go to Tennessee State for a master's degree and to Florida State for a PhD. My mother, after Jackson State, she was one of the classes after James Meredith at Ole Miss, being one of the, when it was, initially integrated. She was one of the classes directly after that. And then she went on back to Jackson State and got an EDS. So my parents were educators. However, they believed in hard work and dedication, but they didn't put any pressure on us to be academically the best. They just encouraged us. They gave us the things we needed and told us, don't settle, do your best, and we'll be satisfied with whatever you do as long as you did your best. So they were a vital part of being able to become successful.
When did you know that you wanted to be a doctor?
So I'd say when I was in high school, it was an interesting story. I was interested in medicine, but I was good in math and science. And I went to my high school counselor and I told her I want to be a surgeon one day. And she told me, she says, well, Fred, I don't think you have what it takes to do that. She said, your parents aren't rich. Your dad's not a doctor. Your mom's not a doctor. Major in something else. Why don't you look at something in math or something in the sciences other than medicine? So that's kind of how I ended up going off to college and majoring in engineering. But once I was in my senior year in engineering, I realized that this was not what I wanted to do the rest of my life. But I wanted to give it a shot. So I did work for NASA and the Department of Defense for several years and decided to make a career change and pursue my goals.
I think that's really interesting. There have been a lot of doctor friends that I've had that have had similar stories in which someone tried to discourage them from their what was perceived to be a lofty dream. And I think
Right.
it's so important for educators to understand and recognize the power that they have in influencing the decisions that we make. Would you agree?
I absolutely agree. And the thing I did that I wouldn't want my kids to do is when that happened to me, I internalized it. I didn't tell my parents. I just listened to her and did it and changed my whole career desire to become a doctor. But luckily, I had the fortitude to continue pursuing it after I graduated from college and worked for a while.
Dr. Harris, some of our listeners may not be aware that medical school requires 4 years after your undergraduate education, and a neurosurgery residency requires 7 years of additional training. Including undergraduate education, that culminates in 15 years of education and training. What was the most challenging aspect of pursuing a dream that required a 15-year journey?
I think it was in several stages. I think just as you say, the 15 years, and plus I did a master's degree in between before going to med school, so it was add 2 more years of 17 for me. And so just the duration of having to be focused and dedicated to try to reach this goal. But I tell you, the hardest part of all of it to me was the residency. The residency was rigorous. It was there were nights when you're not at home, days at a time I was not at home. There was minimal sleep, and you're constantly working and constantly awake, and you're not sleeping. So it was that was probably the toughest part for me. You're doing all that while at the same time you're trying to develop the skills to be a good practitioner and also learn the surgical skills that are necessary. So I'd have to say that residency was probably the toughest part of the whole, goal of getting to this point.
Yes, I would probably agree with that as well. OBGYN is not as long of a residency as neurosurgery. It's 4 years, but it can seem like the longest 4 years in your life with the
Right.
amount of rigor that you experience as a resident. And part of that is your training to be able to handle very difficult situations, even when you're tired,
Right.
even when you've been pushed to the limit, you still need to be able to perform. And the only way to do that is to be pushed in that way. But it doesn't make it any easier and when you're experiencing that.
Right. The hard part for me was one of the things that we joked about in neurosurgery is people that came in after us for residency were walking around attendings and we were still residents. And we saw several classes do that. So it was an eye opener.
When one is pursuing monumental goals as you have done, how important are the choices that you make about your relationships and the people that you include in your circle?
That's one of the most important things, I believe, because you want to surround yourself with people who, A, believe in what you're doing, and B, you want to be around people who want to see you accomplish the goal, people who are positive and that sort of thing. I was fortunate when I went off to med school, I had a very supportive wife, and I had 2 kids at the time when I started residency. And so just having that foundation at home of someone who had your back no matter what was one of the biggest things that I found helpful. But as you say, the whole time you're trying to reach these goals, you just have to surround yourself with positive people who are going to support you, and not people that try to distract you or people who try to get you to change your mind or tell you can't do it. That's what I feel.
Dr. Harris, as a neurosurgeon, I am sure you have had surgeries that have lasted for hours, requiring extreme focus and unwavering dedication to excellence, regardless of your fatigue. What is it about your education and training that prepared you for the rigor of your specialty?
I think it goes back to several things. One is the love for what you do. Okay, so when I'm operating and I'm doing a scoliosis correction, and if it takes 16 hours, to me it literally feels like it's 3 hours. That's just how it feels because I'm focused. I love what I do. But I believe once again the residency, the endurance we learned in residency. I mean, only taking two people per year and having enough work for five people a year was eye opening and really allowed you to be able to do that kind of surgery for that amount of time.
Right. That really puts it in perspective to only hire two people to do the work, but there's enough work for five people. I mean,
Yeah.
that means that you had work probably up to your eyebrows every single day and still could have had more work to do, I'm sure.
Yeah, I can tell you that during residency, the work was never done. I mean, I never felt the whole time I was in residency, I never felt like I was caught up. I mean, Memphis, I trained in Memphis and it was a very great, it was a great place to train. It was a violent city, which, is not a good thing, but it is when you're a neurosurgeon because you're seeing gunshot wounds to the head, you're seeing knives to the head, lamps to the head, you name it, I've seen it. And learning how to manage all that and maintain focus and maintain who you are was a difficult thing to do. But I think the training is what got me where I am.
Dr. Harris, you have 3 kids and a beautiful wife. What has been your philosophy in your home about success, education, work ethic, and how can Generation Z, which Generation Z was born between 1995 and 2015. How can they prepare themselves to compete in education? And how can millennials prepare themselves to compete professionally?
I think one of the things is I always tell my kids the most important thing to me when I'm dealing with people professionally and in the community is being on time. And I tell my kids all the time, I'd rather you be 2 hours early than 2 minutes late. And I tell them that if you're on time, you're late. And also just being affable, being available, and just being capable of what you're saying you can do will get you where you want to get. I mean, you have to stay focused, you have to communicate, and you just have to be persistent. And that's what I teach my kids.
Right. I think that persistence is such a valuable, I mean, everything you said is extremely valuable. Persistence, I would say, is definitely a key, particularly when you're in an environment where an educator may tell you that you don't have what it takes to pursue this dream. So
Right.
you have to continue to be persistent for sure.
Right. Yeah, we can probably both speak to that. I mean, I'm a country boy from Alabama, and I walk in and say I want to be a neurosurgeon. Nobody's going to take that seriously. And so
Right.
I just had to be persistent, had to work hard and stay focused.
Dr. Harris, what would you say are the secrets to your success?
I'd say the main thing is you can be a great surgeon, you can be the smartest person in the world, but if you don't treat people right, they're not going to want to see you. And that's the main thing that I focus my career on is getting to know my patients, getting to know their families, taking care of each patient, one person at a time, one patient at a time, and just listening to them, talking to them, and just trying to get them to make sure they understand what they're going through and being honest about it. I mean, if I'm going to do a big surgery and I know it's going to be a painful surgery and the patient's going to hate me for a week, I tell them that. I tell them, this is going to be a tough situation for you. And, you're probably going to wish you didn't do it for several months, but I think in the long run, you're going to be happy. And I think just treating people like that with respect and realizing that they're people, they have fears, and letting them know that we really care has been the most successful thing for me.
Dr. Harris, I see that you attended a historically Black college and university, and your daughter is currently attending a HBCU. One might say that your family is not the average African-American family in the United States of America. Why was it important for you to attend an HBCU? What did you teach your children about race?
So it was a tradition in my family. Like I said, my parents both went to Jackson State. My grandmother, and I think she was in her 50s or 60s, she went to Southern University. And I ended up going to Southern University. My sister went to Alabama A&M. So it was a family tradition. But one of the things that was important to me was I wanted to go to a university where I could learn about my history. What did we do in this world that I wasn't learning when I went to high school and went to elementary school? And that was one of the main things. And my parents always stressed that HBCUs were great places to develop the character and the confidence you needed to be successful. And so, my experience at Southern University was, I got to know my professors, and some of them are still friends of mine today. It was a family atmosphere, and everybody wanted you to be successful, and you weren't just a number. And that was the main thing I told my daughter, my oldest daughter, who's at Hampton. I told her she could go anywhere she wanted to go as long as it was an HBCU. And she went off to a summer program, and she felt I was joking when I said that, but she ended up going to the summer program, and she loved it, and she enrolled, and she's been enjoying it ever since.
So do you think being a member of Kappa Alpha Psi Fraternity Incorporated contributed to that family feeling that you had?
Absolutely. It was, I pledged with 26 other guys in Alpha Sigma chapter at Southern, and we still text. We have a text chain. We talk every day or every few days. So it's that's one of my sayings died, but all 25 of us stay in contact with each other, or the majority of us do. So it was a great atmosphere. I met my wife there, and she pledged Alpha Kappa Alpha at Southern, and so it was, I'm glad I did it.
Yeah, I would say so too. Many of my listeners may know that I'm a member of Delta Sigma Theta Sorority Incorporated, and I think the sisterhood and the family feel that comes along with being a member of the Divine Nine is something that's immeasurable. It's something that will last a lifetime for sure. In the aftermath of George Floyd's murder by the hands of a police officer, and many examples of police brutality across this country towards African-American men, some may think that because of your status, you do not need to worry about that. Are you ever concerned about your safety? Are you concerned about your African-American son and his safety in America? Have you had the talk with him?
Absolutely. I am always concerned. I grew up in Alabama and went to college in Louisiana, also was born in Mississippi. So, all stages of my life, I've experienced, systemic racism. I've seen it. And it's something that is part of life for African Americans. And I've been stopped, I've been stopped and questioned, stopped driving. I've, told cops I'm going to the hospital. They didn't know, they didn't believe me. So this is not it's not an uncommon thing for anyone, for any of us, no matter what the status is. And I have had to talk with my son, and he's 24 now. And the most important thing I tell him is, if you're stopped by a cop, the most important thing you can do is get out of the situation alive. Like, just don't get baited into arguing. Don't get baited into trying to make it a combative situation. Just get out of the situation. Take whatever the ticket is or whatever you're getting, and just deal with it later, but get out of the situation. Now, saying that, I'm not saying that all cops are bad, but there are bad cops there. But to me, the worst cops are the ones that are good, that don't say anything about the bad ones. And that's what I, have talked to many people I know about. And I'm glad this is coming to the forefront, and especially here in Minneapolis.
Right. I think that's That point about the cops not saying anything, that's so important. I always feel that silence really is an ally to injustice.
Right.
And if you see someone being mistreated, it should behoove you to say something about it, particularly when you have been put in a position to protect and serve the entire community, the entire city.
Right.
So let's pray that your family continues to remain safe, that you remain safe. But I think it's a very valuable conversation, definitely, to have with our children. Let's talk a little bit about healthcare. Across the country, doctors have changed the way they practice. Some are employed by hospitals. Others, like myself, have decided to start a medical practice without financial support of a hospital. You also work in a group independent of hospitals ownership. Based on your experience, do you think it is important for doctors to own themselves? Are there benefits to hospitals owning physicians? What are the fundamental benefits or problems that could arise from environments that are strictly led by large healthcare systems?
I'll start off by saying I think being hospital employed, when I initially came out of residency, I was hospital employed. And the reason was because, specialties can be very competitive. So when you join a large institution or you become hospital employed, you're guaranteed a salary and you're guaranteed patients. And so that was attractive initially for me. But after doing it for several years, I found that I was losing autonomy and losing the ability to kind of control my own destiny, because you're meeting with all the hospital administration or the hospital leaders, and you can request things that you really need, and you may not get them. You may not be able to get them, and they may not understand exactly what you're doing, and they may be looking at dollar signs when you're looking at patient care. So that made it pretty difficult for me. So I decided to branch out and join a private group. And I can tell you, my experience is being independent is priceless. Having your own autonomy, being able to control your own destiny, and being responsible for your own future is priceless to me. So I think there's roles for everybody in either position. But I just felt that after working in the hospital system for quite a while, it was that I was comfortable branching out, in the private practice world.
Mm-hmm. I think the autonomy was a big draw for me as well in regards to starting my own practice. The further I went along in my career, I began to think about the way that I really wanted to practice medicine, and not really thinking about in regards to the clinical aspect. I think every physician should practice it from an evidence-based standpoint, but I'm really just thinking about kind of the philosophy of my practice, the community that I serve. There's a lot of specifics there that I would like to really impact those decisions in the way that I practice. And then, like you said, there are some things that I really feel that, okay, I really need X, Y, Z in order for me to practice medicine in the way that I would like to. And it's nice to be able to think about the strategy of how I'm going to get that and just make it happen. There's no bureaucracy.
Right.
Really, it's just me making that decision. So I'm thankful for the opportunity to be able to do deliveries and surgeries at a larger hospital system, of course. But yes, autonomy is definitely priceless for sure.
Yeah, I'll commend you for taking that step and going out on your own private practice. That's a huge step to make, and you should be commended for that.
Oh, well, thank you very much. In my opinion, it is difficult for two African-American doctors to have a conversation without discussing race. Do you believe physicians have a role in the fight against systemic racism? How have you seen systemic racism in action in a hospital or a healthcare setting?
Absolutely, absolutely, we do. I mean, if we don't speak up, who will? I mean, in my world, is more of the attitudes in relation to pain management. So some people come in and they're in a lot of pain, and they're looked upon as, hey, you're a drug seeker. You do have a spondylolisthesis or a big herniated disc or whatever, but I'm not going to treat you with pain meds because you're probably a drug addict. And so that's one thing I've noticed. And just being discharged from ERs and that kind of thing, people come in and they're just not their pain is just not respected. That's been my experience. And I've always been one to speak up, even in residency. I spoke up when I saw it. I called it out. I wanted to know why this person was treated this way. This person was treated just the opposite. And I think when people realize they're doing that, a lot of times those behaviors can change. And when I was in residency, there were a lot of times when I would go in to see a patient in Memphis, and they just tell me, "Hey, I don't want a black doctor. I don't want you to take care of me." And that's been my experience. And a lot of times I was the only person there on call to take care of it. And once I ended up having to take care of the patient, they became like almost some of the best patients I had after realizing that they were wrong. I've had, and come to mind, I can remember one guy that was a Klansman who he broke his neck, and he refused to let me operate on him, but he was going paralyzed, so I had to do it. I did it, and after surgery and upon subsequent visits, that patient completely changed, and he came and he talked to me about it, and he apologized, and he changed his life because of the relationship that he and I had, because we had dialogue. And that's the most important thing nowadays, I think, amongst people, is to have a dialogue amongst each other, understand where the people are coming from. We all find out we want the same thing, which is a happy, healthy life.
I completely agree that systemic racism is a very important concern in our healthcare system in the United States. And physicians really should recognize that we are at the front line, or even at the gateway of making a difference in regards to systemic racism. Once we begin to deal with issues such as implicit and explicit bias, particularly even in the field of OBGYN, I think we can begin to make a difference in the overall health and well-being of underserved communities.
Right. And that's what we need in this country, in medicine, and just in the country. Dialogue, people to sit down, talk, understand each other, and you'll realize that we all want the same thing.
Dr. Harris, you are a neurosurgeon, and your area of focus is complex spine surgery. There may be someone sitting at home with a history of severe and excruciating back pain. Many may have told them that there is nothing else that can be done. When should someone seek out a second opinion? And where can our listeners find you?
Okay. So one of the things I do when I offer people surgery is I always tell them, don't take my word for it. I'm not the end all to be all. I tell them, if you talk to 10 guys that do spine surgery, 10 surgeons, spine surgeons, you're going to get 15 different answers for the same surgery. So you have to listen to people and develop your own opinion on who you think you want to be operated on by. And I always encourage them to get a second opinion. And so if someone's living with pain and they're told there's nothing that can be done, they need to search second opinions, third opinions, or whatever they can, because I see people and operate on people all the time that have been told that. So I always encourage people to get second opinions. As far as my practice, I'm with Twin City Orthopedics in Minneapolis, and I can be found at www.tcomn.org. tcomn.org. or I can be called at 952-808-3000.
Well, Dr. Harris, thank you so much for your time today on Conversations with Dr. Lane. I hope that we have enlightened our listeners on the subjects that we addressed today. I appreciate you, and thank you so much for all that you do.
Thanks for having me. It was an honor.
This has been Dr. Anthereca Lane with Conversations with Dr. Lane.